Hi, my name is Jocelyn Bunker, and I am an FMP and MSN student at Eastern Kentucky University. The purpose of this video is to present my evidence-based research project for NSC 892. The healthcare problem selected for this review is reducing coronary artery disease, or CAD, by reducing hypertension. According to the Department of Health and Human Services, or the HHS, CAD is the main cause of death within the United States. It's also one of the most preventable. One of the leading modifiable risk factors for CAD is hypertension. Hypertension affects about 1/3 of the adults in the United States, with only about a 50% control rate. The HHS reports that Americans developing or dying from CAD would drop drastically if physical activity increased and hypertension was controlled. Project Walk the Pressure Off is an evidence-based intervention aimed at reducing the risk of developing coronary artery disease by using Pender's preventative health promotion model. Health promotion is a nursing theory based on the idea that preventative health behaviors taken by individuals or groups can minimize the potential threat of illness. The purpose of Project Walk the Pressure Off is to reduce systolic blood pressure by implementing a 12-week low to moderate walking program targeted at newly diagnosed hypertensive adults with an average resting systolic blood pressure between 140 and 159. This target population has been selected because they are newly diagnosed with hypertension and are facing a pharmacological intervention. This intervention has the potential to reduce the participant's systolic blood pressure and possibly prevent or delay the use of antihypertensive medications. Since participation in this intervention is voluntary, we know that this population is interested and ready to address their diagnosis of hypertension, thus implementing the health promotion model. So why is this intervention significant to advanced practice nursing? Well, each year Americans spend approximately $320 billion on healthcare costs related to managing CAD. By creating a practice that is built on health promotion, FMPs can reduce the occurrence and severity of CAD, reduce the financial burden of this pervasive disease, and improve the quality of life of many adults. According to Pender, health promotion is not just preventing illness, it's about giving clients the tools that they need to pursue their best health possible. An integrative review was completed to assess the current research to answer the PICO question. In adults with hypertension, how does low to moderate amounts of physical activity, such as walking compared to sedentary behavior, affect systolic blood pressure within a 3-month period? 4 randomized and/or controlled trials were reviewed. These studies were conducted by Arja et al. 2017, Farinetti et al. 2016, Park et al. 2014, and Petri et al. 2013. Each study looked at the effects of low to moderate exercise on systolic blood pressure by implementing a low to moderate walking program in their intervention group compared to no intervention in their control group. Baseline systolic blood pressure was compared to post-intervention systolic blood pressure. Each study had statistically significant outcomes. For example, Petri et al. 2013 had a p-value of less than 0.05, indicating statistically significant drops in systolic blood pressure. At the end of the 12-week intervention, participants in the IG group showed an average drop of 14 mmHg in their systolic blood pressure. In response to these positive outcomes, Project Walk the Pressure Off is being proposed. This evidence-based intervention will be implemented at Mesquite Medical Associates, which is a rural healthcare outpatient clinic in Mesquite, Nevada, that predominantly serves a geriatric population because Mesquite is a retirement community. What I love about this intervention is that with 294 sunny days per year in Mesquite, walking is a perfect intervention to implement in the retirement population. Clients with a new diagnosis of hypertension will be invited by practitioners at Mesquite Medical Associates to participate in this low to moderate walking intervention where participants will be guided on a 30-minute walk 3 days per week for 12 weeks. 35 candidates will be selected to participate. Each participant will attend an orientation session prior to the start of the project. A fit test will be administered to ensure minimum fitness ability. Then 2 weeks prior to the start date for the project, participants will again attend a group meeting where the baseline systolic blood pressure will be obtained. On the intervention start date, participants will meet at the Arrowhead Park trailhead at either 6 a.m., 9 a.m., or 7 p.m. Participants will mark their attendance in the attendance log before beginning a moderate 30-minute guided walk along the city's park trail. The initial pace will be 3 miles per hour and increase to 5 miles per hour throughout the duration of the project. The proposed evaluation measures are as followed. The main outcome measured in this intervention will be systolic blood pressure, which will be measured at baseline, mid-intervention, and post-intervention. Consistency and accuracy will be ensured by using the same manual sphygmomanometer for each participant and the same method for obtaining it by the same people who are trained on how to do it. 3 resting blood pressures will be taken 5 minutes apart, and the 3 readings will be averaged for the recorded result. Consistency and accuracy of the intervention will be ensured through the use of a Strava app, which tracks pace and distance. Participants will need to participate in 85% of the walks to have their data included in this project. At the completion of the intervention, each participant's baseline, mid-intervention, and post-intervention systolic blood pressures will be placed on a spreadsheet along with demographic information. It will be analyzed individually and collectively using a paired t-test to find statistical significance in the reduction of systolic blood pressure, alpha being set at less than or equal to 0.05. This analysis will be completed using SPSS software. Data collected will be disseminated to the key stakeholders. Practitioners at Mesquite Medical Associates will receive their information in a post-intervention meeting. Community members will receive their information in the Senior Circle, which is a health-based information program organized by the local hospital and held on the first Tuesday of each month. Thank you for watching my video presentation of my evidence-based nursing project. I hope you can see the value of implementing it.